I want to have this on the video. A lot of our patients have diabetes, high blood pressure, high cholesterol, elevated triglycerides, a history of heart attack or things like that. And so their doctor often says, oh, I think you should be on low-dose aspirin. Low-dose aspirin. And there are two groups of people we're going to talk about. This is a review from Journal Watch, which is basically a summary of the latest research in medicine that I subscribe to. And basically, in patients with established cardiovascular disease, you have a narrowed coronary artery, so heart bypass surgery, stuff like that, there's a pretty good amount of data that using a small dose of aspirin can be helpful. And I'm going to talk about that in another video. But what if you don't have that kind of history? What if you're just a diabetic, just have high blood pressure, but don't have evidence of narrowed coronary arteries? What if you just have a risk of getting cardiovascular disease, but it's not diagnosed? In those cases, there have been a lot of studies, and the value of aspirin is very iffy. Right now, a lot of different studies have been done, and basically the short answer is that there may not be much value, and there can be some risk. So just to give you a couple examples, a trial of Scottish investigators. They looked at 1,276 patients, aspirin or placebo for 7 years. And another study from Japan, they looked at 2,500 patients with type 2 diabetes, aspirin or placebo for 4 years. In both studies, aspirin and placebo groups had similar incidence of heart attack, stroke, amputation, and other vascular disease. So huge number of people taking an aspirin every day for 7 years, no difference. Okay? They did what's called a meta-analysis. A meta-analysis, they take dozens of studies and thousands of patients. In this one, they had 18 different studies, a total of 5,000 trials, and they looked at placebo for 10 days to 7 years. They found that there was a decrease in the events, but it was not enough to reach statistical significance. In one study, they looked at 95,000 people in all kinds of different trials, and there was an incidence of a decrease of a risk of heart attack in about 12%, but the overall incidence, if you have to take aspirin for a year, your overall risk goes down by only 0.06% per year for a year's worth of aspirin. So the bottom line is, should you take aspirin if you have a risk and don't have a previous heart attack or stroke? The answer is highly questionable. If you've got an MGB, I think the answer is no. The MGB says no, do not take it because of the risk of bleeding and ulcers. And we can talk with your doctor about that if you get stuck kind of in the middle, John. But that's the latest data for my recommendations, and so it's kind of a question. Okay, now one other thing, and then we can start clinic.